Welcome to this pharmacology quiz on penicillins, part of our Pharmacology Quiz Series. In this video, we will review key penicillin drugs and their roles in managing infections such as streptococcal disease, syphilis, respiratory tract infections, and staphylococcal infections. This quiz contains 10 recall-type multiple-choice questions designed to test your core knowledge. Each question has 5 options, followed by the correct answer and a brief explanation. The video will pause for a few seconds after each question to give you time to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which statement best describes the mechanism of action and the primary lethal effect of penicillins? Option A. They irreversibly inhibit transpeptidases, causing defective peptidoglycan cross-linking. Option B. They block folate synthesis, preventing thymidylate formation and DNA replication. Option C. They inhibit 50S peptidyl transferase, halting protein elongation. Option D. They disrupt cell membranes by binding ergosterol precursors. Option E. They inhibit DNA gyrase, preventing bacterial DNA supercoiling. The correct answer is option A. They irreversibly inhibit transpeptidases, causing defective peptidoglycan cross-linking. This is because penicillins bind penicillin-binding proteins and block cross-linking of the bacterial cell wall, leading to cell lysis. All the other options describe mechanisms of different antimicrobial classes such as sulfonamides, macrolides, antifungals, or fluoroquinolines. Question 2. Which penicillin is most resistant to penicillinase produced by Staphylococcus? Option A. Ampicillin. Option B. Piperacillin. Option C. Nafcillin. Option D. Penicillin V. Option E. Amoxicillin. The correct answer is option C. Nafcillin. The reason is that nafcillin is a penicillinase-resistant antistaphylococcal penicillin designed to withstand beta-lactamase produced by MSSA. All the other options are penicillinase-sensitive agents that are easily inactivated by staphylococcal enzymes. Question 3. Which statement about penicillin's penetration into the central nervous system is correct? Option A. They reach therapeutic CSF levels only with meningeal inflammation. Option B. They always achieve high CSF levels regardless of inflammation. Option C. They cannot cross the blood-brain barrier at any time. Option D. They enter CSF best when P-glycoprotein is induced. Option E. They enter CSF only after renal elimination is saturated. The correct answer is option A. They reach therapeutic CSF levels only with meningeal inflammation. This occurs because inflammation increases blood-brain barrier permeability, allowing higher penicillin concentrations in the CSF. All the other options describe incorrect or unrelated mechanisms that do not reflect the true pharmacokinetics of penicillins. Question 4. You are selecting therapy for syphilis with emphasis on sustained exposure. Which agent is most appropriate? Option A. Piperacillin. Option B. Nafcillin. Option C. Amoxicillin. Option D. Penicillin G-benzathine. Option E. Dicloxacillin. The correct answer is option D. Penicillin G-benzathine. This is because benzathine penicillin G is a long-acting depot preparation that provides sustained low serum levels effective against Treponema pallidum. All the other options lack the prolonged depot action required for standard syphilis therapy. Question 5. Which option is the single correct sentence about beta-lactamase inhibitors and penicillin combinations? Option A. Clavulanate strongly inhibits AMP-C beta-lactamases. Option B. Tazobactam primarily inhibits metallo-beta-lactamases. Option C. Sulbactam has clinically useful activity against Acinetobacter. Option D. Clavulanate reverses altered PBP-mediated resistance. Option E. Sulbactam prevents aminoglycoside enzymatic inactivation. The correct answer is option C. Sulbactam has clinically useful activity against Acinetobacter. This is because sulbactam has intrinsic antibacterial activity against Acinetobacter species in addition to beta-lactamase inhibition. All the other statements incorrectly describe inhibitor spectra or mechanisms that they do not possess. Question 6. Which statement is incorrect regarding hypersensitivity and cross-reactivity? Option A. It can present as urticaria, bronchospasm, or anaphylaxis. Option B. Prior anaphylaxis is a contraindication to re-exposure. Option C. Skin testing can help assess immediate IgE risk. Option D. Cross-reactivity is identical across all cephalosporins. Option E. Delayed reactions may involve T-cell mediated mechanisms. The correct answer is option D. Cross-reactivity is identical across all cephalosporins. The explanation is that cross-reactivity varies depending on side chain similarity and is not uniform across all cephalosporins. All the other statements correctly describe features of penicillin hypersensitivity and its clinical management. Question 7. Which statement about renal elimination and drug interactions is correct? Option A. Probenecid decreases tubular secretion, raising penicillin levels. Option B. Probenecid increases biliary excretion, lowering serum levels. Option C. Penicillins are mainly eliminated by hepatic metabolism. Option D. Probenecid reduces absorption, lowering clinical efficacy. Option E. Penicillins inhibit CYP3A4, raising warfarin levels. The correct answer is option A. Probenecid decreases tubular secretion, raising penicillin levels. This is because probenecid blocks organic acid transporters in renal tubules, reducing penicillin excretion and increasing serum concentrations. All the other options incorrectly describe elimination pathways or interactions not typical of penicillins. Question 8. For MSSA endocarditis, compare penicillins with vancomycin for clinical selection. Which is most accurate? Option A. Vancomycin is preferred when the isolate is MSSA. Option B. Antistaphylococcal penicillins are preferred for MSSA if tolerated. Option C. Both are equally bactericidal against MSSA in vivo. Option D. Vancomycin achieves faster clearance in MSSA bloodstream infection. Option E. Penicillins are avoided due to universal inducible resistance. The correct answer is option B. Antistaphylococcal penicillins are preferred for MSSA if tolerated. The reason is that agents such as nafcillin or flucloxacillin achieve better bactericidal activity and outcomes than vancomycin in MSSA infections. All the other options either overstate vancomycin efficacy or incorrectly describe resistance patterns. Question 9. Which penicillin is most associated with platelet dysfunction and sodium load at high doses? Option A. Penicillin G. Option B. Ampicillin. Option C. Ticarcillin. Option D. Oxacillin. Option E. Amoxicillin. The correct answer is option C. Ticarcillin. This occurs because ticarcillin contains significant sodium and can impair platelet function, especially at high intravenous doses. All the other options lack the same degree of sodium content and platelet effects. Question 10. All statements about aminopenicillins are correct except Option A. They extend activity to some gram-negative respiratory pathogens. Option B. They are inactivated by many plasmid-mediated beta-lactamases. Option C. They can cause a rash with acute Epstein-Barr virus. Option D. They have poor oral bioavailability compared with penicillin V. Option E. They are used with inhibitors to broaden beta-lactamase coverage. The correct answer is option D. They have poor oral bioavailability compared with penicillin V. This is because aminopenicillins such as amoxicillin actually have good oral absorption and are commonly used orally. All the other options accurately describe the spectrum, resistance, adverse effects, and combination use of aminopenicillins. The quiz is now complete, and thank you for taking part in this penicillin pharmacology review. Please drop your score in the comments so we can see how you performed. For deeper study, consider Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, as the key references used for this topic. Any guideline points mentioned in this video are aligned with current BNF recommendations. Subscribe for more high-yield pharmacology quizzes and learning content.